Hey, everybody. Hello.
Hey, I'm Robert F. Kennedy Jr., your HHS Secretary, and today we met with patients from all over the country who have been facing the challenge of paying for their drug prices.
I estimate that I've spent over $180,000 out of pocket just on this one drug.
$9,000 per month that's not an option for me.
I cashed in all of my savings. And at times I worked 3 jobs in order to make ends meet.
This is not something that should be happening in the United States of America. On average, we pay about 300 to 400% larger. In some cases, we pay 10, 12, 13 times what other countries pay for the exact same drug that's made by the exact same factory in New Jersey or some other state.
No American should go bankrupt because of drug prices, and I'm really tremendously proud to be part of an administration that's finally going to do something about that.
And I am encouraged that this administration is boldly and courageously looking to help patients like me.
We're in negotiations right now with the pharmaceutical companies, and we are going to pay the same at the end of this as people pay in Europe and other nations. It's the only fair way to do it, and it's the only humane thing and compassionate thing that we can do for Americans.
Produced by the U.S. Department of Health and Human Services.